My name is Cynthia Donovan. I am a two-time cancer survivor. I live here with my husband and our dog, Chewy, in the north side of Sioux City. The first time I was having chest pain and actually more specifically pain in my breast. Went to our GP. He had done an ultrasound and a mammogram and didn't find anything. So we kind of put it down to menopause because that's what I was going through, hot flashes and all that noise. A couple of weeks later, he called me to ask me if the pain was still there. And I indicated yes, it was. He then ordered a breast CT, and that's where they found the spot on my lung. If he hadn't done that, I don't know. It would have never been detected. We would have put it back to just menopause. The second time, it was when I had my mammogram. So I'm fortunate for screenings, that's for sure, and for good doctor care. I think the first time, it was just the unknown that makes you really scared. And for years, it was always a death sentence. Lung cancer or breast cancer was a death sentence. So the more information I got, the less fearful I became. I think it really wasn't until I came to the cancer center when I met with the oncologist and had more information about what the plan was. Once there was a plan made in place, you start feeling like, okay, the more information I get, the more I can handle whatever might be before me. It's never easier the second time. You get scared even before you get scans. I still get lung cancer screenings, obviously mammograms. So you have to wait for those results and just keep your fingers, legs, and eyes crossed that you're cancer-free. So after the biopsy, then it was time to really sit down with Dr. Wender and talk about what the chemo portion of this would be, and then meeting with the radiology team, which Dr. Murphy was amazing. I had a choice between having a lobectomy or going through SBT. And SBT is really focused radiation to that tumor without damaging a whole lot, if any, of the surrounding part of your lung. I opted to do SBT because I was scared about the surgery. And it did get rid, it really zapped. I called it the Lone Ranger. It got rid of my Lone Ranger. So once I had the surgery, then it was more chemo and more radiation. And I can't remember how many rounds of chemo, like maybe 4, but I think I had 35 rounds of radiation after the surgery. I would say that the silver lining with being a patient here at Junine Island is that the support never ends. So when you enter the building, you're around other people while you're in the waiting room that are experiencing the same issues, obviously different types of cancer and different treatments, but you're all there for the same reason, is to beat the heck out of this and to give yourself hope and your family and your friends that you're going to continue to live another day, another year. It's a great group of people. You never feel alone. You always know that there's a plan. And if plan A is not working, there's a plan B. And they think hard about that. The thing I look forward to the most was ringing that bell. And I remember sitting in the waiting room, waiting for treatment, and people would come out and ring the bell, and there would be celebration and laughs and hugs and smiles. And watching other people survive and watching them being able to ring the bell actually gave me a tremendous amount of hope. We're stronger than we know we are. There were days where I didn't think I would make it. I didn't think I could make it through another day. We are way stronger than we think. We are really fortunate to have the Cancer Center here. Really fortunate with amazing people who are caring, knowledgeable, and supportive. Meeting with oncologists and the oncology nurses, you just feel better. You just feel better knowing that they're taking the best care possible. They were just so supportive, so kind, so very, very, very kind. And I felt like I was in really, really excellent hands.